My name is Danny Rischin. I'm the Director of Medical Oncology at the Peter MacCallum Cancer Centre in Melbourne, Australia. On behalf of my co-authors, this video abstract will provide an overview of our manuscript entitled Integrated Analysis of the Phase 2 Study of Cemiplimab in Advanced Cutaneous Squamous Cell Carcinoma, Extended Follow-up of Outcome and Quality of Life Analysis. Cemiplimab is a high-affinity and highly potent IgG4 human monoclonal antibody that binds to the PD-1 receptor. We have previously reported the results from groups 1, 2, and 3 of an international phase 2 trial. And in the current study, we have pooled 3 groups to provide the largest and most prospective data set for this disease. Looking at the baseline characteristics, there are 193 patients included in this study. Most patients were male with a median age of 72. Most patients had a primary site of head and neck, and the median duration of exposure was 51.1 weeks, and the median number of doses was 18. As you will see in this table, the objective response rate for all 3 groups combined was 46.1% per independent central review. Looking at the data by individual groups, the response rate was 50.8% for group 1, 44.9% for group 2, which was the locally advanced cohort, and 42.9% for group 3. Additionally, the median duration of response has not been reached, and the median duration of follow-up is 15.7 months for population. One of the key takeaways from this figure is that Cemiplimab had increasing complete responses over time compared to the primary analyses. You can see that in group 1, the complete response rate increased from 6.8% in the primary analysis to 16.9% in the first follow-up analysis to 20.3% at the most recent analysis. For group 2, there were no complete responses at the first analysis, but the complete response rate was 12.8% at the subsequent 2 analyses. And for group 3, the complete response rate is increased from 5.4% at the primary analysis to 16.1% the follow-up analysis. The duration of response is particularly impressive. So looking at the patients who achieved an objective response, 91% of these had responses lasting for 6 months or greater. The 6 Kaplan-Meier estimated percent of responses ongoing at 12 months is 87.8%, and at 24 months, 69.4%. Progression-free survival also impressive. Median progression-free survival is 18.4 months. The estimated progression-free probability at 24 months was 44.2%. And similarly, the overall survival results are quite striking. Median overall survival has not been reached for the total patient population, and the probability of overall survival at 24 months was 73.3%. In addition to this robust clinical activity, treatment with Cemiplimab was associated with improvement in global health status, quality of life, as measured by the ERTC QLQ C30 instrument. Here we show the least squares mean change from baseline scores in the global health status, quality of life, and pain scales over time. As can be seen from this figure, improvements in both scales were observed from cycle 2, with statistical and clinically meaningful improvement from baseline in pain observed as early as cycle 3 and sustained over the course of treatment after cycle 12. Significant improvement in global health status and quality of life was observed during initial cycles and reached the clinically meaningful threshold of 10 points or more by cycle 12. In this figure, the proportion of patients with a clinically meaningful improvement or deterioration defined as 10 points or greater change, or maintenance defined as absence of a 10 points or greater change in global health status or quality of life, functioning, and symptom scales at cycle 6 and cycle 12 are shown. By cycle 6, most of these patients had experienced clinically meaningful improvements or maintenance in global health status and quality of life, functioning, and symptoms. Overall, 91% of patients experienced clinically meaningful improvement or stability in global health status or quality of life scores at cycle 12. And most patients experienced sustained improvement or maintenance of their functioning and symptoms by cycle 12. In total, 99.5% of patients experienced at least one treatment-emergent adverse event of any grade, regardless of attribution. Adverse events of any grade led to discontinuation in 9.8% of patients, and grade 3 or greater adverse events led to discontinuation in 7.3% of patients. The most common adverse events of any grade were fatigue, diarrhea, and nausea. In total, 48.7% of patients experienced at least one grade 3 adverse event, regardless of attribution. In addition, 29.5% of patients experienced at least one sponsor-identified immune-related adverse event of any grade, and 9.3% experienced at least one grade 3 or greater immune-related adverse event. There were no new adverse events resulting in death reported for any group in this longer-term follow-up compared with the previous reports. In summary, this analysis confirms the substantial clinical activity of cemiplimab, including new findings of improved complete response rates over time compared to primary analyses, and impressive and increasing duration of response in patients with advanced cutaneous squamous cell carcinoma. In addition, treatment with cemiplimab resulted in a clinically meaningful reduction in pain as early as cycle 2, maintained to cycle 12, and the clinical responses to cemiplimab were associated with reduction in pain. The majority of patients experienced clinically meaningful improvements or maintenance in global health status and health-related quality of life, functional scales, and symptoms. In addition, no new safety signals were observed compared with previous analyses. These results provide further support for cemiplimab as an agent with favorable data to support its use for the treatment of advanced cutaneous squamous cell carcinoma.